Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
All of the factual
Did you read the reports, and did you yourself fact-check them, sir?
I did not fact-check.
You did not fact-check. So why then, as has
all
been widely reported, excuse me, sir, I'm speaking. Why then did the report include a citation to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not exist. How can they be accurate if they did not exist, sir?
Some of the citations
You know, in fact, my understanding is that even once the report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here is that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven. And it isn't based in fact, science, or reality, sir. It's wrong. As the secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The citations in that report were wrong. That was a mistake. They were corrected within 24 hours.
Yeah, but they were wrong still even after that, and they're wrong still today.
There were no
So do you believe that your words carry significant weight?
There were no erroneous
Do you believe your words carry significant weight?
There were no erroneous factual
Do
concerns.
you believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would limit the ability for federal researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals, should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist?